What is the worst advice given to you by a doctor? Was lectured loudly for about 5 minutes by my GP about drug seeking when I asked her not to prescribe me opiate painkillers for a moderate shoulder issue I had come in for. She then told me they needed over $200 in blood tests and to stop by the little blood test center thing in the office on my way out to have the draw done. I mentioned that I just came in because my shoulder pain had lasted too long and become a little more than I thought was normal/acceptable. She left the exam room without saying a word and didn't come back. So I left and did the same.
That sounds frustrating. You went in for some help, and instead, it felt like you were being accused. It's tough when you're just trying to get a solution, and the response you get is completely off base. It's like you've shared your issue, and instead of understanding, there's a lecture. Sometimes you just want someone to listen rather than jump to conclusions. Can be a real letdown when things go that way.
If take this pill is advice, then the worst advice I got was when I was 13. I have dope-responsive dystonia, neurological disorder, Parkinsonian-type symptoms that were getting worse and worse, nearly wheelchair-bound. All I need is a little bit of L-Dopa every day, and I'm 100% fine. They were already treating my cousin this way, with perfect success, but my parents couldn't get the doctor to prescribe L-Dopa. Instead, they gave me Haldol, an antipsychotic usually given to schizophrenics. It took what little dopamine I was producing out of my system and made me so much worse. It was horrible, and being 13 had no idea what was going on. Then withdrawal symptoms when mom made me stop taking it. Just after that I finally got my dopamine pills and I've been fine ever since, but what a traumatic ride.
That sounds really tough. It's wild how one pill can change everything. At 13, dealing with something like that must have felt overwhelming. Being on the wrong medication must have added to the confusion and fear. I'm glad you eventually got the right treatment and found relief. It's a relief to hear you're doing fine now, but those early experiences must have left a mark.
Just take some Gaviscon. No testing, no referrals to a gastroenterologist, nothing. Found a new doctor. Turns out I have Crohn's disease. Also, saw a temporary doctor for cystitis, and she prescribed some antibiotics as it wasn't going away on its own. "Are you sure?" said the pharmacist. "I think I'll give her a call and check. These aren't supposed to be mixed with your immunosuppressants." The doctor assured them that it would be fine. It was not. I survived though.
Sounds like a rough time with doctors. It's frustrating when they brush off serious concerns like that. It's good the pharmacist caught the mix-up, though. Those kinds of experiences can be really stressful, especially dealing with chronic illness. Glad you made it through. Finding the right doctor can make a big difference.
Student doctor. I go in because I'm diabetic and am having trouble keeping my levels down. No tests, nothing. She tells me she's taking me off the meds because I can control this with diet and exercise. I've already been trying, but she won't listen. 6 months later, I'm in the hospital with sugar levels over 900. The ER doctor does some simple tests and determines I am not type 2, but type 1, and my body is no longer producing insulin. I was on ICU for 3 days. I was on the verge of going into a coma.
It's frustrating when a doctor dismisses your concerns. You're doing your best to manage your diabetes, but they just don't listen. It's scary to think about being in the ICU, especially when it turns out you're dealing with something more serious than they thought. It's a hard lesson about trusting your instincts and seeking the right help when needed. Glad you got the proper treatment in the end.
My aunt died of pancreatitis at 52 years old, and my mom died of pancreatic cancer at 44. About a year after my mom passed away, I asked the doctor if there were any tests or scans I could start having done to catch anything early should a problem arise. I was told, "Well, we all have to die of something. Thanks, Doc."
That's a tough situation. Dealing with loss like that can leave you feeling pretty helpless. Asking about tests shows you care about your health, but the doctor's response seems pretty dismissive. It's like they're reminding you that life is unpredictable. You just want to take precautions, but some people don't get that. It's frustrating when you try to look out for yourself and get that kind of answer.
Little bit late to this, but here goes. I had a bump on the side of my head that would bleed whenever I scratched it. It kept getting bigger and more sensitive. I went to my campus doctor. I get it checked out because I was leaving for Peru in a week to go on vacation. The doctor told me the bump was nothing and would go away. Fast forward to me in Peru. We are out in the desert, hours away from Lima, where we were staying, when the bump starts bleeding after I hit it. It doesn't stop as we drive 1.5 hours to the hospital in Lima. Once there, the doctor informed me it was actually a tumor and I had emergency surgery to remove it. Note, no one at the hospital spoke English, and I do not speak Spanish. We captured the whole operation on GoPro if anyone's interested, haha. TLDR, Canadian medical care was shit. Had to go to third world doctor to get treated.
That's quite a story. Sounds like a rough situation being away from home and dealing with a medical emergency. Even more hectic with the language barrier and the unexpected surgery. Glad you made it through, but it's a reminder to always get a second opinion, especially before a trip. Capturing the whole thing on GoPro is pretty wild, though. That'll definitely be a memorable vacation story, for better or worse.
Went to a new psychiatrist after switching jobs to get my SSRI meds updated and, or possible, try something new. I should have known what I was going to get when her specialties mentioned addiction specialist. She was the only available doc, otherwise I would have picked another. While doing our getting to know you chat, she asked if I drank. I do enjoy a beer now and then, and I do drink to get drunk, maybe once a month if I go to a club/bar/party, but it is nowhere near an issue for me. As soon as I mentioned my casual drinking, the conversation switched completely to getting me into rehab, meetings, and addressing my drinking problem. We didn't even get to talking about the anxiety issues that brought me in there. See, my brother is a non-functioning alcoholic, and I know firsthand what problem drinking looks like. And that's not me even by a long shot. I politely told her that was not my issue, left her office, and promptly found a new psych who actually helped me find the right meds for my anxiety. It's the old saying, if you're a hammer, every problem looks like a nail.
It sounds like a frustrating experience. You went in looking for help with anxiety, but the psychiatrist immediately fixated on something that wasn't even an issue for you. It's tough when professionals let their specialties dominate the conversation instead of listening to your actual concerns. At least you found someone better suited for your needs. It's important to have a doc who understands your issues without jumping to conclusions.
After I had my son, I went to my GP and broke down in tears, saying that I was having flashbacks from his birth and panic attacks, that I wasn't coping and I was thinking about suicide. Her response? You should feel lucky that you have a healthy baby. Some women don't. You'll get over it. Well, I didn't, and it took me another year to finally get help. I still suffer with depression and anxiety now, nearly 8 years on, although I am doing much better these days. It took me a lot to go and ask for help, and she just confirmed in my head that I was a shitty person.
That's a heavy story. It's tough when you're in a vulnerable place and someone doesn't respond the way you need. It's good to hear you eventually got help, though it's a shame it took so long. Mental health struggles can stick with you for years, but reaching out for help is a big deal. Glad to know you're doing better now. Sometimes, just sharing what you went through can help others feel less alone too.
I was having anxiety attacks, but I thought it was stomach issues at the time, causing chest pains. I was advised to see a doctor as a follow-up from an ER visit. I was looking for a new doctor and went to this one place. I wait 2.5 hours in a crowded waiting room, kids screaming. I see this doctor as she waddle in, looks at me, and we talk. Her advice? Take Tums. Forever. I asked if there was any other avenue to take, or at least testing, and she said no. Just take Tums. Forever. She must have stock in their parent company. Another doctor told me that lifting weights was bad for me and my heart. He said to strictly stick to cardio, and he is a cardiologist.
Sounds like you went through a lot, thinking you had stomach issues when it was really anxiety. Waiting 2.5 hours just to hear, "Take Tums," must have felt frustrating. It's wild how sometimes the advice isn't really helpful. And then getting told lifting weights is bad from a cardiologist is just confusing. It's tough finding the right guidance when dealing with health issues.
That the pain in my hip was because I was getting older. After many doctor trips, finally getting referred to an ortho, and turns out I had a hairline fracture. By the time it was found, it was pretty much healed. We're having trouble at work reading expiration dates on vaccine vials. Went to eye doctor, and his exam was him handing me a bottle of eye drops and had me read the expiration date. I did. He said okay then, and looked at me like I was an idiot.
It's wild how you brush off pain as aging. I had a similar thing with my knee once. Thought it was just wear and tear. Found out it was something more serious. The eye doctor story hits home too. Sometimes the simplest tests make you feel dumb, but they can be the most effective. It's frustrating, but at least you got answers in the end.
It must be a bad sprain. Here, have some crutches. When it is healed, make sure to do lots of exercise to re-strengthen it. For months later, well, it wasn't a sprain, it's a meniscus injury bucket handle tear. Make sure to get on that NHS waiting list while you can't walk there, mate. No cartilage by the time I'm 40 sounds great.
That sounds rough. It's weird how sometimes what seems like a minor injury turns out to be something serious. It must be frustrating dealing with all that uncertainty. Imagining the long wait for treatment can't be easy. At least you're getting some advice on what to do next. Hopefully, once you're through this, you can find a way to keep that knee strong for the future.
That I would lose weight if I stuck to my low-fat, high-carb diet. I'm insulin resistant. It's actually the worst way I could eat. Spent a decade doing nothing but gaining weight. And he insisted it's because I was weak or cheating. I now eat nonstop fat, protein, and very little carb. Much healthier and much thinner. Same douche refused to send me for testing when I lost sensation at odd places on my body. Next ER sent me for an MRI. Turns out I have MS. Also, same douche told me my kid was faking stomach pain to get out of school. Turned out to be a fecal impaction. He's now retired. Yay!
Sounds like you went through a lot with that guy. It's frustrating when people don't take your health seriously. Changing your diet must have been a big move, but it's good to hear you found what works for you. The whole situation with your kid sounds rough too. Glad you got a better doctor who listened. That dude being retired is probably a relief for many.
When I was a teen, my doctor told my mother everything I was experiencing was in my head. 2 years passed before I was diagnosed with hypothyroidism. It took a thyroid storm to get a diagnosis when all they had to do was check my blood levels. I went to the hospital after my heart rate reached 150 just from standing up.
That's a rough experience. It's frustrating when health issues get brushed off like that. It must have been a relief to finally get a diagnosis, even after all that time. Dealing with a health condition, especially one that affects your daily life, can be tough. It really highlights the importance of listening to your body and pushing for the care you need. Glad you figured it out in the end.
You can get another opinion, but I really feel like it would be a waste of your time. With the advancements in technology, it really levels the playing field to the point where doing more of these surgeries doesn't really make you better at it. Neurotologist discussing a craniotomy to remove a brain tumor. Bonus. He misdiagnosed the tumor type.
That's a tough situation. Trusting a doctor is important, but hearing something like that makes you question their judgment. It's frustrating when you think you're getting the best treatment, and then there's a misdiagnosis on top of it. Just shows how critical it is to seek multiple opinions, even if it feels like a hassle. Better safe than sorry, you know?
I've posted about this before, but for the last year I've had irregular bleeding every 2 weeks, soaking through a heavy pad and tampon every hour. Not normal for me, and debilitating cramps, weird, and seriously uncomfortable urinary problems. Went to the doctor like 3 separate times for tests, only for her to send me home. Nothing wrong with me, take birth control. Tried it, it made me suicidal within a week, all symptoms just get worse. The last time I went to see her, it was because I was pissing blood and felt like I had a UTI. Had tests, no UTI, but still no answers. Sent home. I decided to see a different doctor and found out within a week I have cysts all over my ovaries. Now, not much you could do about these, but at least I feel less crazy now. The last doctor made me feel like I was making a big deal out of normal period symptoms, which isn't the case.
That sounds really tough. It's frustrating to feel unheard by doctors. Switching to a new one probably felt like a relief, getting validation for what you were going through. It's good to have answers, even if the situation isn't ideal. Dealing with health issues can be draining, especially when it seems like no one takes you seriously. It's important to keep searching for help until you find someone who listens.
I went in for periodic intense pains in my ribcage area, specifically on the right side. I told the doctor I thought it was my gallbladder, since my mom just had gallstones about 6 months prior and the location was very similar. He said, "You're experiencing sympathy pain. Your mom had it, now you think you have it. Nothing more than that." 4 months later, I was in the ER and needed an emergency gallbladder removal surgery. I had 35 stones.
That's a tough situation. It's wild how sometimes pain can mess with your mind. You think it's one thing because of someone else's experience, and then it turns out to be real. 35 stones is a lot to deal with. Just shows that listening to your instincts can be important. Glad you were able to get it sorted out in the end.
It's not broken. Sprains are very painful. My arm is broken. Oral pain is very hard to deal with. It was dry socket after wisdom tooth extraction. It's just a sprain. My foot was broken. I used to be heavy. I got these at varying times. If you lost weight, your periods would be lighter and the cramps would go away. Your asthma will clear up if you lose weight. Your acne will go away if you lose weight. Your allergies won't be as bad if you lose weight. Guess what? I'm at the skinny end of the BMI scale, and the only thing that helped with any of those problems was medication.
It's wild how people throw around advice without knowing the full story. I remember when I put on weight, and everyone had opinions on how to fix everything. Lost a bunch, still faced the same issues. Sometimes, it's frustrating. You realize you can't always listen to everyone else's take on health. Just gotta do what works for you, and not get caught up in their expectations.
This probably ISS going to be seen, but I will put it anyway. We found out my brother has a nut allergy when he was about 12 when he ate a chocolate sweet which contained a Brazil nut, and he went into anaphylactic shock and almost died. The doctor recommended to my mom to find out what nut it is by telling her to grate some different nuts into his sandwiches without him realizing, presumably like a placebo, and see which ones he reacts to. Obviously on the basis that this could kill him, my mom did not do this, and she spoke to another doctor in the hospital who was very angry and confused as to why this was suggested, and he said he would write to the doctor that recommended it.
That's a pretty intense situation. I can't believe they suggested that. It's wild how some people don't realize the risks involved. I'm glad your mom didn't go through with it and talk to someone else. It must have been a scary time for your family. Nut allergies are no joke. It really shows how important it is to get proper medical advice.
Obligatory, not a doctor, but a medical secretary. Tried booking an appointment. Was told under no situation could I have an appointment unless I had a phone consultation, first to make sure I don't swine flu and come in and infect the place. Told them I definitely didn't have swine flu. Was told that I'm not a doctor and therefore couldn't be sure. I caved and had my phone consultation. Doctor took 5 seconds before telling me to get to the GP office ASAP. My symptoms? Lump on my testicle. TLDR. Medical secretary made me get checked for swine flu before getting a lump on my bollock checked.
That's a wild situation. It's weird how protocols can sometimes feel unnecessary. You just wanted to get a checkup, but had to jump through hoops first. It's a good reminder that even when you know your own body, the system can make it complicated. At least you got to see the doctor in the end, even if it took a bit. Hope everything turned out okay.
While going through a period of time where I was barely eating and sleeping, and it ended up being pretty severe depression. Instead of recommending me to a psychiatrist and antidepressants, he told me to find my faith in Jesus Christ. Not to knock on religion here, but that wasn't something I was expecting to hear from my doctor. Found a new one, got a psychiatrist and antidepressants, and put that period of my life behind me.
It's interesting how people respond to mental health issues. Your experience shows that some can give unexpected advice. It's good you found a new doctor who helped you with the professional support you needed. Sometimes it's a long journey to find what works best for you. Glad you moved past that tough time.
Broke my ankle this January while ice skating. The guy at the emergency post said, "You shouldn't bend your ankle like that. It's only going to make it worse." He thought I had just sprained it, and that I was trying to reduce the pain by beating it weirdly to the side. Luckily, my trainer is a doctor, so he saw it was broken and sent me to a hospital. To be honest, I wasn't really surprised the emergency guy didn't know shit about broken ankles, since he gave his equipment nicknames and called it his buddies.
That's a rough story. Ice skating can be risky. It's good your trainer was there to catch it early. The emergency guy sounds like he was a bit out of his depth. Sometimes you just hope the people in charge know what they're doing, but it doesn't always work out that way. At least you got the right help in time. Hope your ankle's healing up fine now.
I wasn't aware of what was happening at the time since I was a first/second grader, but when I was 6-7 I got a molluscum infection on one of my arms. For those that don't know, molluscum is a virus that infects your skin and can be transferred from one area to another or one person to another from direct skin-to-skin contact. They form little itchy bumps on your skin. The dermatologist we saw suggested we put some cream on the bumps with a toothpick every day for months, but they never went away. We went to another dermatologist who froze all of them off with a fire extinguisher-like device with compressed CO2, and they went away after one visit. We, or at least my parents, are adamant that the first dermatologist was trying to milk us for money.
It's wild how a simple skin issue can turn into such a hassle. I remember when my friend had something similar. They went through multiple treatments that just dragged on forever. Eventually, they found the right solution, but it felt like a huge waste of time before that. Sometimes, it really makes you wonder about the motives behind those initial recommendations. Glad you found a quick fix in the end.
When my dad was in the naval, dentist had to remove his wisdom teeth, so he clamped down and pulled bits out. Problem was that he clamped down too hard and shattered the teeth. When he got a new dentist, they figured that out and called the dentist my dad had first off his honeymoon tour in Italy to go through the system. He ended up getting his license revoked and discharged with dishonorable, so he could never be a dentist again.
That's an interesting story. Your dad's experience shows how a small mistake can have big consequences. It's wild to think a dentist could lose their license over a procedure like that. The fact that it happened while he was on his honeymoon makes it even more surprising. I guess it really highlights the importance of having skilled professionals in healthcare.
Oh, this reminds me of mine. I fell down really hard on cement. I sprained my ankle and that night discovered I couldn't stop bleeding. It was like a heavy flow day, but it had lasted for over 13 hours. I was getting woozy and feeling anemic. I finally went to the hospital where they made me take a pregnancy test, despite being a virgin at the time, and told me it was my period it wasn't, and charged me $3,000 for the privilege. Mind you, this hospital was notorious for being terrible. I knew someone who went in with a broken hand and ended up getting treated for some virus because they didn't double-check charts. Edit. Yes, folks, I am aware why they did the pregnancy test. I'm not mad about that, but the fact that they did literally nothing else beyond making me pee in a cup.
That sounds rough. I had a similar experience with a hospital visit. I cut my hand pretty badly and went in expecting help. They just cleaned it, gave me a bill, and sent me home. No follow-up or anything. Felt like I wasted a lot of time and money for minimal care. It's frustrating when you trust the system, but it lets you down like that.
That's just like the old joke. John was a clerk in a small drugstore, but he was not much of a salesman. He could never find the item the customer wanted. Bob, the owner, had about enough and warned John that the next sale he missed would be his last. Just then a man came in coughing, and he asked John for their best cough syrup. Try as he might, John could not find the cough syrup. Remembering Bob's warning, he sold the man a box of rSlash and told him to take it all at once. The customer did as John said, and then walked outside and leaned against a lamppost. Bob had seen the whole thing and came over to ask John what had transpired. He wanted something for his cough, but I couldn't find the cough syrup. I substituted rSlash and told him to take it all at once, John explained. rSlash won't cure a cough, Bob shouted angrily. Sure it will, John said, pointing at the man leaning on the lamppost. Look at him. He's afraid to cough.
That's one of those stories that sticks with you. It's a classic case of thinking outside the box, even if it wasn't the best idea. I mean, John was in a tough spot, and his solution was unique. A bit risky, too. I've had moments where I scrambled to find alternatives, but nothing quite like that. Sometimes, just dealing with unexpected situations leads to funny outcomes, even if they aren't always the most sensible.
Same-ish here. Was having problems with my knee swelling and giving out while walking down stairs or hills. Went to the doc about 5 to 7 times over 3 months and was told every time that it was growing pains. Bruh, I ain't grown in 2 years. Finally bypassed the doc and just got it x-rayed. A piece had been breaking off slowly over the course of a few years, caused by either an injury or birth defect, and was now holding on by a thread. Saw a specialist, had surgery, saw my doc at church, she saw my brace and crutches, I smirked and hobbled away.
It's wild how long it can take to get the right answers. I had a similar situation with my shoulder. Kept getting told it was just a strain, but I knew something was off. After months of frustration, I pushed for an MRI. Turned out there was more going on that needed fixing. The relief of finally finding out what was wrong is something I won't forget. Glad you got it sorted out?
When I was 15, I had one who kept asking me what I wash my face with, so I'd tell him Neutrogena Oil-Free Acne Wash Cleanser. It has 2% salicylic acid, which is notoriously drying, BTW, would not recommend. He just kept asking me if it was soap, and then told me to wash my face with Dial soap and apply an antibacterial that's basically just rubbing alcohol. Ugh! When I asked about birth control by saying it helped my friend, he told me, yeah, maybe that's what she says, and wouldn't prescribe it for me. Military doctors, man.
That sounds frustrating. It's wild how some people just don't get the basics, especially with skincare. Dial soap really isn't the solution for acne, and I can't believe the doc brushed off your concerns about birth control like that. It's tough when you can't rely on professionals for proper advice. Makes you appreciate finding someone who actually knows what they're talking about. Good luck navigating all that.
As someone with acne problems and dry skin problems, not eczema, just really dry skin on my face specifically, the thought of that literally makes my skin flake off. PSA: if you go to your nearest Lush store and tell them your skin problems, they have the perfect shit for you. After using that shit, my face feels like a baby's ass.
I've had my struggles with dry skin too. It's annoying when nothing seems to work, and you just want to feel comfortable in your own skin. A friend of mine had similar issues, and after checking out Lush, they found a product that really helped. They can't stop talking about how soft their skin feels now. Sometimes, it just takes finding the right solution to feel better.
I had a doctor ask me if I had considered going to church when I was seeing him for some stress-related physical problem at age 17. I had been in there a couple of times before for physical issues that he determined were stress-related. He should have referred me to a therapist. As it would turn out, I have bipolar disorder.
That's an interesting story. It's weird how some doctors approach things. Instead of talking about mental health directly, he went for church. It sounds like he missed the mark on what you really needed. Discovering bipolar disorder at a young age must have been tough. It's good you're able to look back on it now and reflect. It's important to have the right support in those moments.
I was in a metalworking/jewelry class in high school. I was using a jeweler's saw, really fine blade on a fucking saw, on some nickel, and what I didn't know was that nickel can get slick when cut. Saw hopped out of the notch, and I sliced my hand, gashing metal dust all up in it. I wrap my hand in paper towels and go to the nurse. Door is locked. I knock, she waves that she's on her lunch break and to come back in a half hour. I show her that I need something to sanitize the wound and that it's really pretty bad cause needed. Nope. Turn around, go back to class, I'm on lunch. My teacher looked shocked when I walked back into the classroom. That nurse wasn't there a week later. Metal dust and cuts can get really, really bad. She was not a smart lady.
That sounds rough. I mean, a bad injury and then getting brushed off like that. It's wild how some people just don't take things seriously. Your teacher's reaction must have been something. It's crazy how quick things can go wrong in a class like that. Glad you made it through okay, though. Just goes to show you can't always count on the people who are supposed to help.
I passed out and fell chin first into the asphalt playground, which opened up a nice big gash on my chin. I'm in the nurse's office with a bib of blood on my shirt, and she tells me that she will not call 911 or my mother. She was going to clean it and give me a Band-Aid and send me back to class. She then proceeds to start picking pebbles and stuff out of my wound with tweezers and tells me to hold still and stop squirming. My screams brought the school receptionist running in, and she finally called my mom. Went to the hospital with irate mom. Got a bunch of stitches.
That sounds pretty rough. I remember a time I fell off my bike. I didn't get hurt as badly, but I did scrape my knee pretty bad. The school nurse just cleaned it up and sent me back. It felt like a bigger deal then. But looking back, it was just one of those moments you laugh off later. Your story definitely brings back those memories of dealing with scrapes and stitches.
When I got hit in the face with a volleyball, spiked by one of the strongest kids in class, I went to the nurse with a gushing nosebleed. She insisted I stay as far away in the nurse's office that I could from her, so she didn't have to see me while I stopped the nosebleed on my own. She couldn't stand the sight of blood and told me to just tilt my head back and it would stop. Fortunately, I had chronic nosebleeds as a kid, so I knew how to handle it, but wow, incompetent.
That's rough. Getting hit in the face with a volleyball isn't exactly a fun time. The nurse not wanting to deal with you just adds to it. It's good you knew what to do though. Chronic nosebleeds can be a pain, but at least you had some experience. It's kind of funny how some people are just not cut out for certain situations, like handling blood.
Please consider subscribing if you enjoyed. Love.